Malaria kills more than 600,000 people each year. Most of the victims are children in Africa. Ghana's government has cleared the new malaria vaccine for use in children between the ages of 5 and 36 months, with the hope of putting an end to malaria-related deaths in the country.
The efficacy again in the first year is around about 75%. So like most vaccines, this isn't perfect, it isn't 100% effective, but reducing the caseload and particularly deaths by 75% would be extremely important.
The vaccine was developed at the Jenner Institute at the University of Oxford in the United Kingdom. Clinical trials took place in 6 African countries before its usage was approved in Ghana.
The way this vaccine works is we've taken just one component of the malaria parasite. It's called the circumsporozoite protein, and that coats the parasite that is inoculated by a mosquito bite. So there are only about 10 or 20 parasites injected, if you like, by the mosquito, and they're all covered in this one protein. And what we've done is made a vaccine out of that protein that induces very strong antibody levels against the circumsporozoite protein and blocks its transmission. In other words, the immune system clears the parasites soon after they are injected into the skin by a mosquito.
The new malaria vaccine brings hope of ending the misery of the potentially fatal mosquito-borne disease.
We continue to follow up to make sure there aren't any late side effects from vaccination, and of course to determine how long the vaccine works for. And it might be that after 3 or 4 years, another booster dose would be required.
Scientists say its invention brings satisfaction to the years of hard work they put in while trying to discover.
This is a milestone for us. It's been 30 years in the making, this vaccine. There have been lots of candidates over 20 that we've taken into clinical trials and have not worked so well. But, from the outset, from 2012 in preclinical studies, 2015 in the clinic, this vaccine has looked very promising. So it's fantastic to see it come through to this stage.
The World Health Organization is considering whether to give its own seal of approval to the vaccine. In January, WHO announced that medical trials of the vaccine would be expanded to more countries across Africa. Jean Keo, CGTN.